remember.
Yes, sir.
I think we have prepared it from the Nizora article.
Yes, sir. Yes, sir.
So, as she rightly said, it is a facial plane block. It is not done by blind technique as we do majority of our blocks. The square block requires definitely ultrasound guidance. So it cannot be done blindly without looking at the anatomical things. So what are all the structures, boundaries of it's a facial plane block in the abdomen. So it comes under the category of facial plane blocks since to block the abdominal wall. So all the anatomy points he has described. That's a variation of tab block. Anteriorly, you have three muscles. This one picture will give you a beautiful idea about what are all the muscles. In the anterior aspect, you have the three muscles: external oblique, internal oblique, and transverse abdominis. And posteriorly, these three muscles, erector spinae, quadratus lumborum, and the psoas major. These are the three muscles which form the, and this is the transverse process of the L4. So this looks acts like the stem, and these are the three let's say portions of the leaf. So that forms the shamrock sign, and it is a thoracolumbar fascia and tubular structure where the drug will be centered, and the sensory root supply is between T7 to L1. And by injecting a large volume, you are allowing the drug to spread and block the level from T7 to L1. It is mainly an adjuvant block. You cannot do any complete surgery with this block alone because it provides more of a sensory blockade rather than motor blockade. So muscle tone will be still maintained and it cannot be used as a sole anesthetic technique for any surgical procedure. So it is mostly for analgesia purpose to reduce the requirement of other narcotics and other analgesic agents. And the preparations always, whenever a block is asked in the theory question, you can divide the answer into four parts. One is the preparation, second is palpation, third is puncture, and fourth is the dosage. So here the preparations are consent must be obtained, IV access should be there, all the monitoring should be done, and you must prepare the skin with antiseptic, and you need a 22 gauge ultrasound needle which should be of 50 to 100 millimeters length because you have to go quite deep into the plane, or you can use a 2C needle if you plan to give a continuous technique inserting there a cannula into there, and you have to have a sterile probe, gel, everything for using that, and you must give at least 20 ml for each side. And the stop before you block. What is this? What is this description of stop before you block?
Before
this is a routine precaution that has to be followed before any regional technique. What is that? Have you heard of this terminology?
Yes, sir. Yes, sir.
What is that?
Before giving block, again confirm the patient's name, surgery,
Yeah.
and what type of procedure and which side, sir. Side
Correct.
of the procedure.
So this is a safety check. Before blocking, confirm the patient's name, surgery, side of surgery, if not in the midline. So one type of fuel block you have to do is, this is a large volume of local anesthetic injected. It's a more of a field block. Bilateral block will be necessary. Ultrasound guidance is a very important thing that is needed for this block. And there are different approaches. Position of the patient is in the lateral position is more convenient, and success rate is very high. You can give a pillow under the dependent side, and just like a kidney bridge, you can just open up the space so that you can see the correct insertion. And there are four approaches. Two are where the drug is deposited superficial to the quadratus lumborum muscle. The third and fourth approach, it is through the muscle, posterior to the muscle and inside the muscle itself. So transmuscular and intramuscular are the quadratus lumborum 3 and 4 block techniques. Whereas 1 and 2, you deposit above the muscle on either side, anteriorly or posteriorly. And always an incline approach is used for all the four approaches, and the curvilinear probe with a frequency of 2 to 6 hertz is important. And you get the Shamrock sign, that is, you start the probe with the horizontal position from cranial to the iliac crest. Okay? Just use the probe like that, and then try to identify the Shamrock sign, and then the structures which can be induced by. This is the picture, will give you an idea nicely. So this is the iliac crest. You can see that bony prominence. So just cranial to that, just abutting that, you put the probe in the transverse direction, and you can identify the three muscles: external oblique, internal oblique, and transversalis. And the needle direction comes here, and it is deposited just a little above the muscle. And this is the quadratus lumborum muscle. This junction, this is the anterior approach, and this is the transducer position 1, and this is the second approach where you deposit that posterior. So this is a quadratus lumborum at the lateral. This is the posterior approach. Again, the needle goes into that this thing. 3 is transmuscular. So in this one picture, you have all the directions of 1, 2, 3, and 4. So you can see that quadratus lumbar 1 is the drug is deposited just on the above the quadratus lumborum, between the quadratus lumborum and psoas. And in quadratus lumborum 2, it is more towards the anterior abdominal wall. And in 3, it is coming through the muscle between the transverse process and the psoas major, so posterior to the quadratus lumborum. And in 4, it comes directly into the muscle itself. So that is the quadratus lumborum 4 block, where it becomes intramuscular. Sorry. And the test dose is given, and then the spread has to be the spread has to be watched for. Complications are, as we said, block failure and sympatholysis causing hypotension. This is another important problem, because the drug will spread through the paravertebral space also. And this is the slide I prepared for OSCE. So here the Shamrock sign is seen. So this is the transverse process. You can see the quadratus lumborum is on the piston, psoas on one side, and erector spinae on the other side. So why it is called shamrock? It's a small plant with 3 round leaves on each stem. So this is how the leaves look like, and this is also the national symbol of Ireland. And the quadratus lumborum block is performed in the lateral and posterior position, and this is the true vilva leaves that we use. Vilva, it's called vilva leaves in English, but vilva in Tamil. And so that's all the thing about quadratus lumborum block. So the main points that you have to remember are: it is adjuvant block, and it requires ultrasound, and it is a facial plane block requiring large quantities, and has to be done bilateral for surgeries in the midlife. These are the points that have to be in the